The contrast enhanced scan of a 72 years old male. The patient is bed bound because of CVA for last many years. Now the pulmonary findings are those of pulmonary tuberculosis, quite extensive. Now the patient has presented with high grade fever with rigors. Now just see, these are the evolving abscesses here. These aggregates of stippled lucencies and change in the altered texture along these cluster of cystic lesions. These are the evolving abscesses, quite typical of them. In the initial phases, these are small lucencies. Ultimately, there is confluence of these cystic lucencies, there is necrosis, and you come across a bigger cystic lesion. Now, smaller cystic lesions are also present. Now, just see the spleen as well. These are the splenic abscesses as well. These lucent areas in spleen. So, liver abscesses as well as splenic abscesses. If liver abscesses were not there and similar hypodense lesions were present in a case of tuberculosis, the possibility of granulomatous inflammation or infection of the spleen should have been considered. But now, since liver is involved, there are evolving liver abscesses, and you can just make out that alongside these abscesses, the density of the adjacent fat is increased. This is suggestive of the inflammatory process here. Just see this area here. And same is the case with the spleen. The densities, just see the straining here, inflammatory in the adjacent fat. If these would have been granulomas, then you don't find this haziness in the adjacent fat. This is typical of the acute infections.